everyone, this is your exam 2 review video. I'm sorry this is a little bit late. I have been moving, I have been packing a trailer. I got settled into Illinois and then I still had to unpack my car, so it's been chaos. I'm sorry that this is getting to you late. I also apologize it's a little noisy. I am doing this outside because it's a beautiful day and you know, I just didn't want to bother my family that I'm staying with. So we're going to go ahead and get through this. Probably do exam 3 video review right after this, so it'll be the same situation. I do apologize. Alright, so for this, there are some things that you need to know, of course. I've got it, I'm pulling it up on my phone so I can see it. Of course it doesn't want to download. Well, I'll go through the format of it while it's downloading. It will be the same format, 25 questions, multiple choice, A, B, or C. Please read carefully because I didn't set it to do this on the first exam, but it randomized the answers, so I think that is a feature of eCampus because I did not tell it to do that. So please read carefully because the answers just say A, B, and C, but A might be listed as the choice for B, right? So make sure you're reading carefully. Alright, so looking at this, we talk about health policy, so health insurance systems, attributes of fee-for-service, fee-for-service models contribute to overprescribing, trade-offs, Medicare, Medicaid, health insurance, single payer, universal coverage, talking about sick around the world. So I'm going to go through each of these. They might not be in the order that the study guide is in, but we will go through each of them. Sorry if you can also hear my dog panting. He won't leave my lap. He's very concerned that I'm going to leave him. You can see his head right here. So this is him. He's a little brat. Alright, so know how doctors in different countries felt about their own healthcare systems. So like Germany, for example, felt that the healthcare system was underpaid and unsatisfied, meaning that doctors were underpaid because they don't have to pay for medical school, that they are underpaid, and they are unsatisfied within their careers. Know about the Speaking Up project. Sorry, there's a dog outside. The Speaking Up project where it was actually Dr. Totske was part of the team, if you've ever had him. And they went to hospitals in Michigan and they were talking about speaking up and reporting errors. So know who medical errors tend to be reported by, and that is nurses. Know about the fee-for-service model and why we thought it was contributing to the opioid crisis. Basically, providers are reimbursed for the care that they give, and that could incentivize over-medicating people. Okay? Know about the decision-making team and how some professionals like nurses or medical assistants are left out. Know why that is. So professions like medical doctors are viewed as more prestigious and valuable, so we tend to think that they're going to have the best ideas all of the time. But really, if you think about it, nurses are the ones that are doing most day-to-day operations, so they should make these medical decisions. Know that single-payer insurance is typical insurance that is, oh wait, nope, I'm reading my notes wrong, I'm sorry. So typical insurance that is provided to you by an employer can be indemnity insurance, it can be fee-for-service, but it cannot be single payer insurance. Okay, so make sure you know that. Okay. We call our premiums the monthly payments to health insurance plans. Deductibles are what you have to pay until your insurance kicks in, and you know, usual, customary, reasonable charges are what you're charged for services, but the monthly payments are the premiums. Make sure you have watched the movie Sick Around the World. It showed that some countries, like the United Kingdom, use a gatekeeper model for accessing care. and it closely resembles the health maintenance organization insurance structure, so HMOs, meaning you can only go to certain providers within this certain network. So know about your HMOs and your PPOs. To be a Medicaid enrollee, you must work full or part-time. Like I said, know about HMOs and PPOs, know about fee-for-service models. We talked about that a little bit. Medicare and Medicare, make sure you know it's Medicare, in the U.S. is going to closely resemble single-payer insurance, so make sure you know that. A lot of countries spend too little on health insurance, or healthcare, not health insurance, healthcare. So make sure you know about the countries that spend too little. When we say that we are drained and used up, I say we like we're in the medical profession. We're not. But when we're talking about being drained and used up, know that that is depersonalization, because I'm not a human anymore. I'm just a cog in the machine. I'm just the doctor that gets this done. I talked about the Speaking Up project, so make sure you understand the hospital's culture and the rules and policies that go into place. Understand organizational perspectives and why providers might rush through talking with the patient. It's because we're on a set schedule, we're on a timeline. I have 5 minutes with you, I cannot go over that. Understand the emotional burnout, or burnout and emotional distress. So healthcare providers might be especially prone to burnout and emotional distress because they're more concerned with others and they are easily overwhelmed and emotional with their encounters that they have. Know about medical errors and what should happen or what patients want when they occur. So patients want an apology and an explanation. They don't want an excuse. They don't want you to get fired or anything. And half the time they don't even want any sort of payout from it. They just want you to apologize to them. I'm sorry I made this error. It won't happen again. This was definitely an eye-opener or a learning experience, whatever. Alright. Know about the push by the Trump administration and the health insurance coverage for legal immigration. That's one of the things that Trump wanted during his tenure, his time as president. He wanted every legal immigrant could get health insurance, but illegal immigrants could not. So he basically wanted to change, you know, Medicaid. Not Medicaid. Maybe Medicaid. I can't remember. But he wanted to basically change it and say, no, it's not for everyone. It's only for those that are legal immigrants. Know about West Virginia and the Medicaid expansion. So we are a state that has accepted the Medicaid expansion. We go along with it, like most other states. Know about structuration theory and the culture of the organization. So culture oftentimes recreates and reproduces itself through communication. Know what patients don't want when a medical error occurs. They don't want the doctor, the provider, the nurse, whoever, they don't want them to be fired. They want an apology and an explanation. They typically do not want them to be fired. Know about healthcare teams. So sometimes if you need a quick decision, an individual provider might be a better choice, and that's true about healthcare teams. Talk about empathy in medical school. So empathy typically plummets during medical school and training. I think this might have been a question on the first exam, maybe, or on the first study guide, and I apologize, it's on this exam. So empathy typically plummets during medical school and training. You stop caring about people because doctors and physicians are told to be distant, but not sound distant, right? So they don't feel all their emotions. So what would it mean? Know what it would mean if health insurance has a $3,000 deductible. That basically means that you have to pay $3,000 out of pocket each year before your health insurance would kick in. That would be a very high deductible, but that's what you have to pay out of pocket each year before your health insurance would kick in. Understand universal healthcare coverage means that all citizens of a country are covered by some kind of insurance. So if they are a citizen of your country, so America, they are covered by some sort of health insurance. Okay? And that is exam 2. I'm actually not going to do exam 3 review right now. I'm going to save that for later in the week when I've got a little bit more free time. So if you have any questions, don't hesitate to reach out. And yeah, best of luck. Don't forget, you also have assignment 3 due this week. This is the only week that it's like that. You have your exam due by Friday and your assignment due by Friday. So make sure you get them both done in a reasonable amount of time. All right? Like I said, if you have any questions, don't hesitate to reach out.